Hi, I'm Dr. Joy Tsai from Tri-Service General Hospital, Beitou Branch in Taiwan. It is with my great pleasure to share with you 4 recent articles focusing on child and adolescent mental health during the COVID-19 pandemic. To start with the pandemic and children's mental health, earlier this year, the UNICEF has already warned that at least 1 in 7 children, meaning that there are in total 332 million children globally, has lived under required or recommended nationwide stay-at-home policies for at least 9 months since the start of the COVID-19 pandemic, putting their mental health and well-being at risk. Especially for those children experiencing violence, neglect, or abuse at home, lockdowns have left many stranded with abusers and without the support of teachers, extended families, and communities. Children in vulnerable population groups such as those living and working on the streets, children with disabilities, and children living in conflict settings risk having their mental health needs overlooked entirely. Today, I'll start with the impact of COVID-19 in children. Special focus on the psychosocial aspect. Then some tips on communicating with children about COVID-19. And then we will move to the European ADHD Guideline Group's suggestion on ADHD management during the pandemic, and some tips for helping parents and caregivers of young children with ASD during the stay-at-home period. Although in contrary to adults, children infected with COVID-19 reportedly are having milder disease with low morbidity, better prognosis, and probably lesser susceptibility. We still need to keep in mind that children with pre-existing illnesses are still at heightened risk for poorer outcome once they get infected with COVID-19. The global spread of COVID-19 has been a life-altering experience for most families. That is also why we're talking about its impact on children's mental health today, because daily life has changed, and routines that families have been accustomed to have undergone major changes. Just to start with a few, schools are closed. Children and adolescents are forced to stay at home. How are they coping with the change? When family members get infected, how are our children processing and understanding the quarantine? Not to mention increased child abuse after the lockdown. And poverty remains a huge issue when it comes to lifestyle change and all sorts of resources. We'll start with psychosocial impact on quarantined children. Being quarantined could be a psychological burden and psychosocial stigma. Children undergone drastic change in their lifestyle, physical activity, and mental exertions. Those being isolated from their parents suffer the most. Getting detached from parents may cause everlasting psychiatric consequences, including PTSD, anxiety, psychosis, depression, delinquency, and even suicidal tendency. Thus, as frontline physicians, we must be aware of the psychosocial need of the quarantined children. Hospital authorities also need to make arrangements so that children can still keep in contact with their parents. Government should make operational strategies to provide mental health care for the quarantined children. Moreover, children whose parents are detached from them due to quarantine will also be equally stressed, anxious, distressed, and feel insecurity due to this forced distancing. Regarding school closure, for children, school is not only an educational hub, but also a home outside the home with plentiful free space. Schools offer windows of freedom, scope of interaction with fellows and seniors, psychological solace besides providing educational, academic teaching and all sorts of learning resources. School plays an important role in promoting importance of personal hygiene, physical activity, healthy food, and body habits. Even a short-term shutdown of educational institutions and home captivity for children is indeed troublesome and anticipated to have detrimental effect on children's physical and mental health. For many children, school is also a place for nutritional support, and shutdown will intensify their food insecurity, which in turn can be correlate with low academic performance and ample risks to general well-being of the students. Learning gap will also be widened between children from lower and higher income families during this institute closure. Child abuse, dropout from formal education, indulgence into high-risk activities, and proliferation of child labor could be potential socio-economic consequences of the pandemic. Therefore, appropriate articulation between classroom and online education, educational financial assistance to the needy students, and ensuring zero dropout from schools post-pandemic are urgently needed. As for child abuse, domestic violence, and teenage promiscuity, reports of child abuse, neglect, exploitation, and domestic violence are on horrendous rise at the time of COVID-19 pandemic and lockdown. Both direct and passive exposure of the children to abuse, psychological aggression, and physical punishment by caregiver at a very early age could cause impaired development of brain and their mental health. High rates of psychosomatic and neuropsychiatric disorders, multiple substance abuse, and suicidal thoughts. Loss of parent affection and care, financial deadlock, school discontinuation will certainly outrage the risk of sexual exploitation, teenage pregnancy, transactional sex, similar consequences that were faced by children from Africa after the Ebola epidemic. As most of the online social network companies have shifted their in-office employees to work from home mode, the regulation and review of potentially harmful contents have gone automated from manual. This automated content moderation has multidimensional fallacies, and the resultant response may be late or inept. This window of opportunity is being used by offenders to abuse children online. COVID-19 has opened up avenues for more cyber crimes, and criminals are taking advantage of suppressed cybersecurity at this hour. Therefore, strict parental vigilance, along with monitoring from cyber cells, is mandatory to prevent this cycle's sexual aberrancy. Poverty hits the children hardest and makes them vulnerable to the pandemic. Low-quality healthcare, higher mortality, and sustained financial limitation hurts the poor children most and nourish the pre-existing inequities. Marginalized communities, including the migrants, the homeless, the prisoners, are heavily affected by this pandemic, and their special needs their specific needs to be addressed. Millions of children live in detention facilities, immigrants camps, orphanages, or similar institutes. They are confined in overcrowded camps, informal reception stays, and squatter centers with no arrangement for safe drinking water, food, sanitary barriers, and medical services. These places will act as a fortified and enriched culture media for any pathogen, especially COVID-19. Moreover, basic hygiene such as frequent hand washing, physical distancing, and virtually unattainable in these places. Nothing can be worse than the fate of these helpless children who will ultimately be soft targets for criminal minds, human trafficking, and exploitation. Patients with mental health issues readily get infected with respiratory tract infection like this one because of cognitive unsoundness, lack of self-care and awareness. Nationwide strict lockdown is making it impossible for the ill children to visit their psychiatrists or counselors, along with interrupt supply of regular psychotropic medication. Subjects who are already suffering from serious mental disability should be dealt with extra care, otherwise there will be a potential for flaring up of their underlying illness and worsening of quality of life. While periods of lockdown is a golden opportunity for parents to mingle with their children, the story for parents who works in the health care services and defense services are different. Their children are missing them more than ever due to fear and guilt of contamination of the lethal virus to their little ones. Seeing these parents' hard work and sometimes being misunderstood by the neighbor or bullied by schoolmates may create long-term psychological consequences like anger, aggression, and generalized disregard for the society. Experience from the Ebola outbreak has taught us that severely limited access to basic healthcare would lead to spread of both COVID-19 and other non-COVID-19 diseases of public health importance. For example, children with type 1 DM cannot get their insulin shot regularly, or children with HIV cannot get their antiviral drugs, or children with airway diseases are not getting their inhalers on time. The pandemic will tremendously disrupt sexual and reproductive health services as well. Therefore, the authors propose several interventions. For parents, pediatricians, psychiatrists, psychologists, social workers, hospital authorities, governments, and NGOs, we all have to work together to make the mission of protecting our younger ones successful. Children learn from their parents' behavior. Therefore, parents need to respect their identity, free space, special need in addition, have to monitor children's performance, behavior, and self-discipline skills. Friendly interaction and communication between parents and children may also help soothing their pandemic-related anxieties and other physical and mental issues. Governments and NGOs should make sure to bring all the children back to their schools by any means when the pandemic ends, and should ensure zero dropouts by providing financial support specifically to pandemic-undermined families. Schools should plan restyling academic and calendar and tests to infeasible an effect of school closure. Social sites should be more cautious to censor online sexual exploitation, and parents should always friendly monitor their children's online activities. Responsible authorities should also be aware of probable domestic violence and child abuse. For children who have lost their family or parents in a pandemic, welfare centers should trace them and keep them under care of other live family member, kindship care, and trained foster care as much as convenient. strict social security, prevent school dropouts, child labor, child trafficking, and sexual abuse. So the author proposed several steps to curtail psychosocial burden on children in COVID-19 pandemic. So starting with the basic needs of food and clothes, we go into maintain education, to provide education, and to prevent child labor and child abuse. And then we'll move into physical and mental strengthening for further better society, in hopes to entering a beautiful world ahead of pandemic. So it does take a whole village, the whole society's strength to raise a child. And then we'll go into some tips in communicating with children about COVID-19. Although healthy children and adolescents may have a lower mortality rate than adults impacted by coronavirus as a population cohort, these children and adolescents remain highly vulnerable to the psychosocial implications of the pandemic during their families, communities, and world. Children are experiencing unprecedented changes to their senses of security and normalcy. Many are witnessing the loss of family members. They may also be noticing the ways that the new virus is overtaking structures and systems that previously seemed secure from their worldview. Therefore, Dr. Megan Weaver and her colleagues suggest introducing strategies normally used by the palliative care team in communicating about COVID-19 with children and adolescents. Here are the tips. First, honesty and trust. Children react to what they observe from adults around them. Creating an environment including a comfortable space and place for children to feel secure means active listening and answering a children's question with honest responses and appropriate for children's development age. Being open and sharing information can reduce anxiety, confusion, and misperceptions. Children may ask if many people are dying from the virus, and the honest answer is yes. Children may ask if there is a cure for the virus, and the answer is not yet. But the scientists are working hard to help us find one. When the answer to a children's question is unknown, an honest answer will be, well, this is a great question. I do not know, but I am grateful you feel comfortable to ask me these questions. The second one is self-compassion. Children can feel and will react to the anxieties of the adults around them. Adults should admit that emotions such as fear, anxiety, sadness exist, and then model healthy habits such as healthy eating, relaxation, breathing, moments of exercising, restorative sleep, proper hygiene to live through these real feelings. For some families, the loss of connection with members of familiar faith communities or attending services can feel alienating from what was a predictable life. The loss of physical gathering with a spiritual community can feel lonely. And so families may consider attending familiar religious services online or engaging in shared ritual together as a family activity. The third one is safety. As children sense a lack of human control, teaching children tangible ways to try to be safe can be empowering. Behavioral modifications can be spoken of as ways to keep ourselves and others safe, such as hand washing while singing a 20-second song, such as practicing safe sneezes, avoiding handshakes and high fives, and increasing cleaning routines. Also remember to praise for good hygiene can encourage continued behaviors. Sensitivity is also very important. Intuitive and conscious awareness of the children's level of curiosity, maturity, development stage, and current emotion are essential to protect the children from too much or too little information. Similar to palliative communication tasks, effective communication include an awareness of what the children knows by asking the children, inquiry how much the children wants to know, creating a safe and trusting space to allow the children to initiate timing and content, transparency, and communication check-ins. Sensitivity includes protecting the child from external fear messages on the television or radio. Adults should limit children's exposure to media, as many children may misunderstand what they hear and can be especially frightened by what they do not understand. The current public health crisis may exacerbate feelings of anxiety, stress, irritability, sadness, detachment, and other symptoms. For those families should reach out their healthcare provider, mental health provider, faith leader, or other trusted person. Those with known mental health disorders may deteriorate and should be sure to be in touch frequently with their mental health providers. The next one is connection. With school closure, deliberate and creative forms of connection offer children the security of human connection. As for preparedness, consider discussing preparedness in a way that models caring for the community and hoarding. Family caregivers may consider helping children create a list of purchasing to foster a sense of being planful over panic. To promote active coping, families may consider creating a how we will take action listing naming preparation, gathering drinking water, gathering healthy food, batteries for games, books, and other activities. Family may also consider keeping a how we stay positive list, naming their gratitude or the small joys brought by each new day. The next one is community building. Purposely sharing that all humans, no matter where they are from or the color of their skin, are in this pandemic together as a human family allows children to associate connection with global peers. In stressful times, altruism can be a very powerful coping strategy. Talking as a family about opportunities to help others, even if instilling hope or optimism, can be a powerful motivator for finding meanings. Another very important issue is death as part of the life cycle. In this changing world, children are hearing about the human suffering and loss of human lives beyond the usual cultural tendency of trying to avoid such topics. If children inquire about death or dying, families may consider this as a good opportunity to share family beliefs about the meaning of a good life, to share about families' belief about an afterlife with a child, or to discuss the family's spiritual perspective. Families may consider asking a child about his or her fear or hope if the child initiates such conversation. Remember to reassure the children if they or family members are currently not showing symptoms may create a sense of safety for the children. The last one is legacy. Looking at family photos and discussing generational lineage may help orient a children to their life legacy. Reminding our children that they are part of a lineage of connected and caring community member and recalling the legacy of ways humans have preserved together in history may serve as a way for small children to hold a sense of place with a large narrative. In an uncertain time and place, the grounding principles we mentioned prior are strategies of the palliative care team often used to communicate with their patients. And these strategies are fundamental, and when brought to bear, can bring comfort to families and children. Next, we'll be moving into the European ADHD Guideline Group's suggestion in managing ADHD during the pandemic. The EAGG has developed guidance on the assessment and management of ADHD during the COVID-19 virus pandemic. Given the requirement for physical distancing, all relevant services provision should be continued via telephone or appropriate online video technology, in line with current recommendations for the use of telepsychiatry. Schools and teachers should try to monitor all their students, but should include those with ADHD, especially adolescents, as a priority group because of their disorganization and increased level of risk. For example, are they participating in online classes? Are they submitting their tasks on time? Are there any concern about their social and emotional well-being? For families with children with ADHD, the EAGG recommends the use of behavioral parenting strategies because they improve parenting and have beneficial effects in reducing oppositional defiant and disruptive behavior, which is common in ADHD. Individuals with ADHD should, if clinically indicated and as recommended in standard national guidelines, be offered with an opportunity to start on pharmacological treatment after completion of the initial assessment. Or if this patient is already on medication, he or she should continue with this as usual. And families should keep in mind that we should always avoid increasing dosing and adding dosings to manage a crisis or stress related to confinement. Similarly, the use of antipsychotic medications to manage disruptive behavior or the use of sedatives when not clinically indicated should be avoided. Given that family confinement and physical distancing might exacerbate ADHD-related risks, we see no strong rationale to introduce weekend drug holidays during the current crisis. Routine cardiovascular clinical examinations and face-to-face monitoring for individuals with ADHD without any CV risks should be postponed, because currently the risk of conducting face-to-face assessment outweigh the benefits of CV monitoring. Sleep disruptions can be caused by other factors associated with the COVID-19 pandemic outbreak, such as stress, late morning waking, and disruption of daily routines. Therefore, appropriate sleep hygiene should be implemented. In conclusion, COVID-19 and the related physical distancing measures are presenting many challenges for children, young people, and their families. And these challenges are likely to be considerably greater for those with ADHD. It will therefore be important to draw upon the strategies routinely recommended in parent-focused ADHD interventions, as well as mental well-being interventions for children and young people. If the use of medication is deemed desirable, strategies for remote monitoring should be implemented. Next, we're going to share with you 10 tips for handling young children with ASD during stay-at-home period. The first one is to explain to your children what COVID-19 is. Children with ASD have a concrete cognitive style. And it is important to explain what COVID-19 is and why we all have to stay at home. The explanation has to be simple and concrete. For this purpose, it is possible to appeal to augmentative alternative communication. It is also possible to ask for help from therapists in preparing a brief pamphlet titled "What is COVID-19?" using individualized AAC strategies. Second is to maintain structured daily life activities. It is widely reported that children with autism spectrum condition have executive function deficits, and they could show issues in planning their daily life activities, especially when the routine is broke. For this reason, it is important, especially now, to maintain the structure of daily life activities. It would be useful to subdivide the daily activities and assign different rooms for different activities. The third tip is to handle semi-structured play activities. Children with autism spectrum condition enjoys playing. During the day, it will be important to handle play activities. Choose activities that your child prefers. For important, Lego therapy could be a good solution for children with autism spectrum condition who are low or high functioning. Lego-based therapy is an increasingly popular social skill program for children and young people with social communication problems. Fourth, use of serious games. Serious games can be useful to improve social cognition and to recognize facial emotions, emotional gestures, and emotional situation in children with autism spectrum condition. Fifth, shared video game and/or interest sessions with parents. Video games and the internet are extremely attractive for children with autism spectrum condition, but they could also become an absorbent interest, especially in this period when children are called to stay at home. It is not possible to avoid them playing video games, but at this moment, parents could join them and share their interests and to understand them more. 6. Implement and share special interests with parents. The logic is pretty similar to share video games and interest sessions with parents. 7th, online therapy for high-functioning children. It is well recognized that psychiatric vulnerabilities and/or comorbidities are high in children with autism spectrum condition. So if the children were engaged in psychotherapy before the pandemic, it is very important that they continue. Since many therapists have stopped their face-to-face therapy, it is strongly advised to continue the psychotherapy in an online video or audio modality with the same weekly appointments. It could reduce the anxiety, check the mood, and offer a child a private space in which they can talk to a specialist. 8. Weekly online consultations for parents and caregivers. Parents of children with autism experiences more stress and more susceptible than parents of children with other disabilities. At the moment, parents are alone in handling their children with ASD. This can represent a further high risk for their stress levels. For this reason, it can be very useful to have an opportunity for a weekly online consultation with their therapist with a therapist of their children. 9. Maintain contact with the school. A growing body of research supports the suggestion that the relationship which children form with their teachers and classmates have an impact on learning. For the maintenance of social contact with the school companions, it is suggested to have at least weekly contact with one of the class companions. It could be an online video for those that prefer it. For children with autism spectrum condition who do not prefer to use video for online contacts, they could be encouraged to write letters to one of their school companions or to call them by phone. For both children and parents, it is strongly encouraged to maintain contact with a special teacher online or by phone. Lastly, is to leave spare time. Children with autism spectrum condition have to be stimulated, as pointed in previous tips. But it is also possible to leave them a proper quota of spare time during the day. For example, encourage them to take a short walk near the house. In this period, children could have an increase in stereotypes. This does not need to be a particular concern. At the moment, when habits are changing, the stress levels can be elevated for children with autism spectrum condition, and an increase of stereotypes could be the behavior result of perceived stress. They will certainly not regress. So the conclusion is, COVID-19 is questioning the routine of our young children with autism spectrum condition, and they are called to respect rules and habits that are not always understandable for them, and therefore causing profound suffering. So we all, as parents, therapists, or researchers, we all must be united and quickly establish new and functional routines to allow our young children to be safe and peaceful. As autism spectrum condition experts, we have to find different ways to be close to our patients and their families to support them. These are my references for today's speech. Thank you very much for listening. And until we can meet in person again, please stay safe.